Hello, my name is Ellen Snowball, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today we are summarizing Engagement of People with Lived Experience of Dementia Advisory Group and Cross-Cutting Program, Reflections on the First Year, by Snowball et al. The keywords for this article are lived experience of dementia, patient and public engagement, and dementia. The research objectives for this article are support persons with dementia and care partners to be actively involved in the CCNA research process, work with CCNA research teams, cross-cutting programs, and partners to develop novel mechanisms and formats to further this collaboration, to advance the methods of patient engagement in research, specifically including persons with dementia and care partners. Why is this important? Patient and public engagement has been argued to lead to better quality research with greater impact. It is also advocated as a human right, whereby the public, and particularly people impacted by the research, can have a say in publicly funded research. Background: over 500,000 Canadians are living with Alzheimer's disease or another form of dementia. This number will nearly double by 2030. In 2014, clinicians and researchers formed the Canadian Consortium on Neurodegeneration in Aging with the aim to advance research. The engagement of people with lived experience of dementia, or EPLED, is a cross-cutting program developed for the CCNA. EPLED conducted a survey of CCNA researchers to describe their knowledge related to patient engagement in dementia research. 93% of respondents agreed that people with lived experience could contribute to research. Respondents indicated that barriers to including engagement in their research included lack of resources. This included recruiting people with lived experience who were interested in research. These findings motivated the development of an advisory group composed of people with lived experience of dementia who would work with the CCNA researchers as collaborators in research. Methods: recruitment began with a lay language poster and application form that was shared on the CCNA website. Anyone with lived experience were encouraged to apply. This included people living with dementia, friends, family members, and caregivers or care partners. 62 applications from people with lived experience of dementia from across Canada were received. After interviews, 17 individuals from across Canada were invited to join the advisory group. Definitions: patient and public engagement. Patient is used as an overarching term to refer to personal experience of a health issue, and informal caregivers including family and friends. EPLED, engagement of people with lived experience of dementia. CCNA, Canadian Consortium on Neurodegeneration in Aging. Challenges: COVID-19. EPLED members experienced personal challenges. This included loss of a loved one or being isolated from family. Online meetings. Challenges included scheduling meetings in various time zones, as well as finding a video conference platform that accommodated member preferences and devices. Ties took longer to develop within the advisory group. Differing expectations and priorities. Advisory group members discussed opportunities for advocacy. Members saw immediate need for public and care provider education to improve practice. researchers articulated longer-term academic goals, for example, grants and publications. Lessons learned: develop trusting relationships. Establishing strong working ties with mutual respect and trust were vital. Valuing different perspectives, giving equal space for feedback. Providing support and clarity on roles were essential to building reciprocal relationships. Provide education and support. EPLED provided initial training through a curriculum. There were ongoing opportunities to educate members about research processes. Be flexible. Members face potential barriers to involvement with the advisory group. This included managing scheduled meetings with care partner work and family responsibilities. To support advisory group members, EPLED developed a flexible approach. Acknowledge tensions and imbalances. Members and researchers have a common goal: to improve the lives of those affected by dementia. Establishing shared understanding on approaches to meeting the goal required open discussion. Importance: challenging stigmas. Through research, people with lived experience can create opportunities for voices to be heard. Creating meaning. Members felt that their experiences might help others. Contributing to research. More relevant and impactful research for people living with dementia and care partners. Identifying barriers. Working alongside advisory group members can help researchers to identify barriers for people with lived experience of dementia. Conclusion: EPLED was created to support persons with dementia and care partners to be involved in the CCNA research process. The advisory group was formed to work with CCNA researchers to develop new ways to further collaborate, as well as to advance the methods of patient engagement in dementia research. People with lived experience of dementia can and should have roles in research beyond study subjects. EPLED has exemplified that people with lived experience of dementia are effective collaborators in research. People with lived experience of dementia can impart new ideas, approaches, and insights on dementia, create meaningful connections, and challenge stigmas associated with dementia. Building inclusive, respectful, and supportive relationships and spaces with people and communities has the potential for important impact across these groups. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.